Okay, so welcome and thank you all for joining. This is the fifth ReThink Health Toolbox webinar. I'm Brooke Mulia. I'm a Senior Program Associate at the Ripple Foundation. If you're new to Ripple or to this webinar series, we're so thrilled to have you. And rest assured, if you have not attended prior webinars, you can still fully engage with the material that's going to be shared today. To orient us, I just wanted to briefly share where we've been, where we are, and what's coming up next. So past webinars we've covered include an introduction to the vital conditions for health and well-being, an introduction to shared stewardship, and an overview of belonging and civic muscle. The most recent webinar series was an introduction to multi-solving, and recordings of those webinars are available on our website. Today, we're going to continue the series with an introduction to the Three Horizons framework. Our next webinar in April will cover an introduction to resident engagement, and I'll talk a little bit more about that towards the end of our presentation. So the intent of the ReThink Health Toolbox webinar series is to help us all embrace our role in transformative systems change. It's also a way for us at the Ripple Foundation to share a one-on-one level introduction to ReThink Health's tools, practices, and frameworks proven to drive change. Today, our primary intention is that each of us, no matter where we are along our journey, walks away with a basic understanding of the Three Horizons framework. So towards the end of this presentation, and we'll open it up for Q&As, I just want to know a few norms. I want you all to feel free to share questions and reflections in the chat as we go. We'll address them as best as we can live, and we can also address questions during our Q&A. We also want to encourage you guys to turn on your camera if possible and just look around and notice our friends, our connections that we haven't even made yet. I see a lot here today and many new faces, and we're so honored to have you with us today. So thanks again for coming. Lastly, I want you to know that a link to the recording of today's presentation is going to be included in the slides, and also supporting materials will be emailed to you within a week. So I also want to tell you that this series is one but many ways for us to build a movement towards thriving together. And we have a lot of shared language on how this can be achieved. So stewards are people or organizations who work with others to create conditions that all people need to thrive, beginning with those who are struggling and suffering. And stewardship is not new, and nor is it a one-size-fits-all process. We're going to include a link in the chat to essential stewardship practices that focus on three areas: connecting across differences, creating opportunities, and learning and adapting. Next slide. As you'll recall, the vital conditions for health and well-being are the factors and properties of places that we all need to thrive and to reach your full potential. So these include things like necessities, like humane housing, access to meaningful work and wealth, and also a sense of belonging, our civic muscle. So during today's webinar, we'd like for all of us just to keep in mind legacies for living together. These include legacies that we've inherited from our predecessors and those we are contributing to today, and those we will leave behind. The Three Horizons framework is going to help us illustrate the fact that we all possess enormous capacities to transform current and future conditions, for better or for worse. Given this potential, it's important to ask ourselves, what legacies would make us good ancestors for future generations to come, which also ties back into our intro question. So thank you guys for that. I'm so thrilled to introduce our presenters today, Maggie Cook, Strategic Partnerships Manager, and Bobby Milstein, Director of System Strategy. So now I'll turn it over to Bobby. Bobby?
Thank you so much, Brooke. And thanks to everyone for being here. It's great to share space with so many kindred spirits. As Brooke said, the topic for today is the Three Horizon Framework. It's really a practical tool to help us be serious about the future that we're creating and to really bring the practice of visioning into the work that we do every day. We'll have moments a couple times throughout this hour to exchange ideas about the signs that you're seeing, about the kind of future that's unfolding now and the work that we can do to help make it real. And we'll end with some practical tips about how to incorporate the practice of really inclusive and deliberate foresight and why that matters so much in creating the future that we most want to see. I wanted to sort of begin in a personal way, right? If we're going to move toward a future with all people and places thriving together with no exceptions, What does that mean for the kind of work that each of us do as individuals, as organizations, as networks? I mean, this can get very big and elaborate, but some of it is really personal and how each of us look at our orientation toward the future. So we'll start with this really quick poll about when you think about the future, what's your usual approach, right? Are you more comfortable as a manager, as an entrepreneur, or as a visionary? And I appreciate that these words have a lot of connotation, but start whichever one moves you like without overthinking it. Okay, so I kind of expected this a little bit, right? Some of everyone, right? We need managers to run the organizations that that do the essential work of establishing conditions for health and well-being in a population. So can't do this work without managers. And at the same time, our organizations, the ways of working, our habits and mindsets, they all can be improved, right? We can get innovative. We can be entrepreneurial about this work. We can, sort of innovate. And we want to make sure that we are doing all that work of managing day to day, thinking of new questions and new innovations, but doing it in a way that really matches what we most want to experience, right? The visions that we know are possible, the things that draw us, our heart and our heads and our hands into this work. And so we need people who are comfortable in every one of these roles to do that work. And I'll just share a kind of a personal story about the organizational home that Ripple and ReThink Health has provided me for the last 15 years to do this work, and many others across the field. And so, Ripple is this year celebrating its 70th anniversary as a foundation. And for the first 55 years, like a lot of philanthropy in the country, we had really high aspirations of making, big impacts on heart disease and cancer and the role of women in society, and new treatment of elderly and the changing role of hospitals. It was not uncommon for the head of the foundation to be talking about this quote that you see on the board, right? Everything we do should be the well-being and the benefit of countless individual lives, no matter how long the path may be to that end. It's a really dedicated, almost inspiring commitment, unwavering commitment to the work of pursuing well-being in society. But the fact of the matter is, as a day-to-day kind of operating practice, we were making relatively small bounded grants, each in sort of seeking singular solutions for being able to achieve these kind of high aspirations. And the mismatch between the ways we were working and what we wanted to achieve became increasingly clear and uncomfortable. And by 2007, there was a real move to rethink everything about what we were doing as a philanthropy, who we were connecting to, our goals, our ways of working, our tools, really the whole thing. And there were a group of change makers with whom we had sort of deep and persistent dialogues about what does it mean to really do this work in a world where heart disease and cancer and the roles of aging and our institutional emphasis on hospitals, all of these things are so interdependent that it really becomes hard to have singular solutions. And Ripple, through that process, ended up launching ReThink Health as our sort of collaborative sort of initiative, and refocusing everything we do on the work of equitable system change to create a just and thriving future. And if we fast forward, to today, we've got sort of two main ways of working. Ripple is a nonprofit operating foundation. We ceased making grants. We really bring our entire team, all of our tools, all of our resources to be an effective catalyst for an equitable future of health and well-being. So we haven't lost that relentless commitment to an equitable, thriving future, but we're doing it now through close action learning with innovators like many of you in regions across the country. And the goal there is to ask big questions and to learn things we don't know the answers to now. How do we discover and support and share what it takes to thrive together through shared stewardship? It's a little bit of our organizational story about rethinking what we did on a day-to-day basis and making sure that what we are doing is more closely aligned to the future that we most want to bring to life. So let me stop there and let Maggie pick it up on how this marries with our topic today, the Three Horizons framework. So I'll stop sharing for a moment.
Thank you, Bobby. Welcome, everyone. We just wanted to spend a few minutes at first to talk about what this framework is and why it matters. Lots of folks here may be familiar with the framework already. It might be brand new to some of us, and many of us may be somewhere in that middle. But this framework is one tool that can get us imagining how we can pivot from a system that was never built for everyone to thrive. Although we aren't necessarily accustomed to thinking about the long-term future, as stewards in this movement, we can practice. We can build our own capacities. We can actually stretch our imaginations and dream beyond the day-to-day problems and issues that can often feel intractable. In her book called Future Good, Trista Harris writes, "The purpose of paying attention to the future isn't so you know exactly what is going to happen and when. It's that you have an idea of how to change what you do today to make tomorrow better. So take heart. There are ways of getting there." At Ripple, we apply the Three Horizons framework across a lot of our work as a mechanism for thinking about the future we're trying to grow and how we might nurture innovations, mindsets, and practices that advance the system we're trying to create together. The Three Horizons framework comes to us from the International Futures Forum, or if you're really into acronyms, IFF, and it's quite widely used in strategic foresight and futuring work. Bill Sharp, who is a member of IFF, calls it patterning of hope. And at least to me, it begins with heart. The Haudenosaunee philosophy that comes to mind is the seventh generation principle, in which decisions we make today should result in a sustainable world 7 generations into the future. While it can be difficult to look that far down the road, it beckons us to think of legacies, something we'll get to a little later on today. If helpful as a starting point, we sometimes encourage people to think about the future they would desire for their grandchildren's generation, to open our minds and really consider that. That's what I mean when I say hope. So let me show you how it works. Bobby, if you could show the slides again. The Three Horizons framework begins with this, the first horizon, or the ideas and practices that are the most common or normative. You'll see on the on the y-axis, popularity of defining norms, and on the x-axis is over time. Next slide. These are the practices that dominate right now, the world as it is. Yeah, there we go. As you can see here, that over time, business as usual ceases to be viable. It declines over time as it is no longer fit for purpose. Right now, in so many ways, we can see and feel and study how the current system is really built around fragmentation that produces negative outcomes. We may not have created this system, but is it what we will actively decide to choose to leave for generations to come? So what are a few examples of such business as usual practices or mindsets? So in terms of healthcare systems, we see a focus on competition, siloed efforts, and a narrow focus on specific service lines that result over and over in fragmentation and poor health outcomes. Or culturally, some examples that are currently dominant are how normative it has become to have deep divisions or overt violence in society, or how little interdependence is felt across the population, or thinking about how our energy consumption is currently dominated by dependence on fossil fuels. These practices are not sustainable and can't last forever and will decline. In contrast, there's a viable future, or the third horizon, H3. The third horizon is the future we dream of. And if it's going to become the norm, it's going to take a long concerted movement to achieve it. Though not mainstream yet, we see hopeful pockets of it springing up in lesser known margins. For example, in certain practices, ways of working together, and deeply appreciating interdependence. But how could we get there? Next slide. If we look at this whole graphic together, there are a few things to notice. There are pieces of every horizon in this current moment. That distant, equitable future that we dream of, the third horizon, there are pockets of that present right now. And though they may be small, if we can notice those signs, we can nurture and grow them. You can also see more clearly how the second horizon bridges the first and the third. The innovations that characterize the second horizon allow us to take forward some of what is valuable about the first horizon and build a bridge to the third horizon. So let's briefly cover a few examples of H2 practices at second horizon, like we did for the first. For healthcare systems, maybe wanting to take accountability for improving maternal and infant mortality outcomes. H2 practices might include intentional integration of doulas and non-medical birth support staff. Socially and culturally, examples of H2 practices can be efforts to depolarize politics or the healing effects of helping people feel more connected, like those discussed in the Surgeon General's report on loneliness and isolation. Or back to our earlier example of energy consumption. H2 practices could be establishing ultra-low emission zones. These are just a few examples to get us thinking about what practices might actually help us bridge from the first to the third horizon. So we all come to this work from many different starting points. One person's H2 can be another person's H1, but to move further upon this y-axis than where we are now, working hard for this to become the norm requires all of us to have the courage to let things go outside of the norm, have the courage to be the courage to let things go. So going outside of the norm, having the courage to be human in dehumanizing times. It means giving up a lot of what's creating polarization. What does it mean to be a steward in these times when we consider the long term? At Ripple, we hold a future in which all of us thrives together, no exceptions, not just as an aspiration, but as an expectation, requiring us to think and work differently. How do we collectively make such expectations more of a norm rather than an exception? Even if it's not routine or comfortable in your own town or city or organization or culture. This simple tool helps us to see what happens over time when we break cycles of perpetuating the same norms that prevent us from imagining and fostering a more hopeful future. At the center of the vital conditions for health and well-being is belonging and civic muscle, which conveys a sense of being a part of something bigger than ourselves and having the power to shape our common world. In that, there's a refuge, knowing none of us can do this alone. There's a lot of room for individual and organizational courage. The more we're in conversation, the more courageous we can become. And it's important to note that not everyone shares the same vision, but we can think about how there's a big vision for where we want to go, and then a need in the middle to roll up our sleeves and do some real experimenting with might get us there. The Three Horizons framework is a tool that can be applied to any sector. The gravity of using this tool to become a more catalytic philanthropy is evident in the work of Cassie Robinson, whose work is so inspirational and has encouraged us at Ripple to connect and partner with other philanthropies with this framework in mind. So here are a few philanthropic practices she's mapped out across the horizons. And just for example, you can see that an H1 approach to leadership, maybe to hold primary accountability to a board. And an H2 practice may be accountability to the grantee, whereas an H3 leadership practice could include being accountable to the system and the ambition of the work. Cassie's work reminds us that every industry can evolve. So we thought it would be a good time at this point to take a moment and discuss together, how is your organization evolving to fit your highest purpose? We hope some of you might not mind coming off mute and sharing some of the shifts or changes that you've made that you celebrate, and or what are some of those shifts in others, be it individuals or organizations that you admire. Here, I think we could take maybe about 7-ish minutes or so if people would like to chime in. So again, how is your organization evolving to fit your highest purpose? Or where do you look for inspiration, or what do you admire in others? Or maybe even if it's not a traversing across the horizons, what are some practices that maybe you individually or in your organization are really trying to focus on now that you hope to continue to evolve?
I'll share one just to get us started here.
Cool.
So I teach at a business school. MBA programs should have a point of view around health equity and the role of markets to advance health equity. So I'll be teaching a class for the first time this spring on the topic of health equity, and hoping to better understand on behalf of my organization the role we can play in teaching students and informing students that hopefully will then go kind of make some of those changes out in the world.
Maggie, what we're finding in working with lots of different groups and trying to bring people together is that the organizations are not set up for that. The organizations are set up to do a thing, a food bank, primary care, insurance. And so a lot of the thinking we've been doing, building on the work you've done, is how to think about new organizations with new cultures and a new mission that rewards Horizon 3, because there just aren't a lot of organizations around that really give you credit for bringing together the primary care with the food bank and the housing people. That's not what we were set up to do. We were set up to do the food bank. So trying to find what's missing is a lot of the challenge I think we all face.
Yeah, we were talking about that in some of the examples earlier. They're certainly not specific only to healthcare systems, but yeah, that competition, siloed approaches, and not, you're right, not incentivizing something that goes beyond the status quo, which in many ways can give us the feeling that we can get stuck there, but it doesn't have to be that way. Any others? We'll also have time for Q&A later on. If you think of something in the meantime, I mean, this is a good gathering of stewards. This is where these conversations can happen, and we can push some boundaries together. I'll turn it over. Oh, Kathy, did you just come off mute?
I did.
Oh, hello.
I was really struck by Paul and David's comments, and I think they characterize some of the space that stewards like myself inhabit, which is creating a vision of an alternative future that can be shared by multiple parties. And that's not, simple and easy work when, as David said, people are very focused on their sort of organizational purpose, and maybe more inwardly thinking about that, and believe appropriately in many ways that what they're doing is really important, and that it's sort of central to progress, and sort of thinking at the system level is a transition point that I think entrepreneurs in H2 can help bring people forward at.
A beautiful point, and helps make a great segue into, I would add to that too, Kathy, something that's often kind of drilled into us is the scarcity mindset, right? So like, I've got to get this grant for my food bank, because if I don't, like, no one else is going to be providing those services. And so we'll get to a bit of that a little later, and we'll definitely be addressing an abundance mindset in a future generation. Oh, I see a hand up. Go ahead. Do you pronounce it Sane?
Yes, Sani, like Danny, except Sani.
Hi.
Just this conversation reminds me of a conversation that I was in with some state innovators, and they were saying they needed a place that was safe for them to fail. If you want people to innovate, you want people to have new visions, new ways of thinking, not all of it's going to work out. And so how do we create places where people can succeed but places where they can also fail and learn from that and not be punished or, lose their jobs because something didn't work out. And so I think just having spaces to learn from one another, so there's less failure going forward, but at the same time, having places where you can fail and you can learn from that and move forward.
And that even creating a space like that and or contributing to a space like that takes exactly the courage we were talking about before, right? It's not necessarily an everyday practice. Or when is the last time you blocked an hour on your calendar to dream about what the future could look like, and how what you're doing today may not be serving that future, not in a critical way, but like we often don't build into practice that time to just dream and scheme and think about, well, what if I make these changes and express that I'm working towards something different. Beautiful. Thank you so much for sharing. Oh, my dog, sorry. Bobby, I'll turn it over to you.
I just want to appreciate Kelsey's comment in the chat here, and just in less than 10 minutes, we've ended up having a discussion about some real circumstances, right? This is not just like an exercise. This is about, what is the typical way we run a business school? What's the typical way that we identify, partners in this work and resource them and become, thinking about the incentive structures, the caliber of the issues that you've just named in these last 10 minutes are really where the work happens. And we wanted in this next section to just sort of bring a little bit more space to the characteristics. These are typical features of conversations around this very simple tool. When we put up these 3 horizons, it gets us thinking about the hyper present that we live in at the moment and the ways in which it gets reinforced over and over again, as well as the long future. And we just a year or so ago, our entire organization read the 4 Pivots book by Sean Ginwright. Maybe some of you have also. And one of the finest things about this book is his discussion about moving from problem orientation to possibility. It really marries with the conversation today. And so I just want to play like a minute quote from Sean himself talking about why it's so important to concentrate on that H3 future and add that discussion into our routine ways of thinking. So here's just a minute from Sean.
I'm not sure how many of us really contemplate freedom, because so much of our time is focused on solving intractable problems and fighting for justice. But our inability to contemplate freedom and lean into a possible future is one of the most significant barriers we face in creating justice. We can create the future we wish to see rather than simply eliminating the present conditions we need to change. But we have to take seriously our capacity to see beyond the challenges we face and the problems we need to solve. It is critically important that we dream and imagine as well as fight and resist.
That last point about recognizing that this is a capacity, right? It's a capacity like any other that we can grow and expand, or that we can neglect and cause to erode, right? If we don't take these questions of future horizons seriously, the surest path is to reproduce the status quo, a future that none of us really necessarily want. And this gap between the fragmented present, marked so much by us, them, division, by a scarcity mindset, by some people thriving and many others systematically struggling and suffering over generations. None of that is necessarily a world that people on the whole want, but they don't necessarily know how to move toward an interdependent way of working. If it's drawn like this, it feels like a big leap and it's going to take forever. And that leads to some negative mindsets about visionaries where they're just dreamers and they don't necessarily have a way of making this work happen. But as Maggie said, there are always signs of interdependent, examples of efforts around love and liberation, indigenous cultures that have never lost sight of what it means to build an interdependent community and to perpetuate those values over generations, even when the dominant sort of norms around are devaluing or even actively destroying the foundations of that cultural practice. And so it's the discipline to recognize that, yes, we may dream of a new normative future, but around the margins, remember the y-axis is about what's popular, what is common, what is routine. There, if we look to the sort of innovators around us, the ancestors who are carrying on traditions that matter in the present, there are always signs of these pockets in the future, and those can become animating forces in this work. The space of H2, we've talked about, the fact that this work is not easily rewarded. Sometimes it can feel incredibly risky. How do we lower that risk? How do we increase the odds that people will find new ways of working, reach across their organizational boundaries, reach across their sector boundaries, to acknowledge that, yes, we're running a food bank today, but the food bank is part of a bigger story on how do we thrive. And tomorrow it may be that we need to sort of concentrate on the transportation systems that connect us to food, and not just rely on how do we deliver food to those in a crisis, but how do we build a food system that is built with everybody's needs routinely in mind? And how does that connect to the, sort of deep understanding of what it means to have food sovereignty and foodways that are linked to our culture? So we use these dotted lines on the left to illustrate that the H1 present that we experience today did not come out of nowhere. In many cases, it grew over time. The interdependent future that we're aiming for is not foreign. We can see signs of it in the present. We can look for examples of it in our past. And the kind of shared stewardship that we're looking to make happen is a capability that we all have. And sometimes innovations can be only marginally different than the status quo. They take a lot of time and energy, but in the end, are they really significant changes in the ways of thinking and acting? So the goal here is to try to get more sensitive to those innovations that are going to be breakthroughs, the H2 plus side of the sort of diagram, and to be aware that some innovations are really only marginally different, and they're going to keep us locked in that H1, H2 minus space. This is all meant to be contested. It's going to be turbulent and volatile, and that's the kind of future that demands of us to be even clearer about what are we willing to let go of in order to work for something better. And that's true individually, like in our own ways. We've all been socialized into the roles that we play, into organizations that have a way of working. And for a significantly different future to happen, some of those comfort zone issues we're going to have to relax our devotion to doing that in favor of something much better. And those become generational questions. I'll just give an example of work that I so much admire, and colleagues across the Fox Cities region in Wisconsin have taught us so much about what it means to become more interdependent. Just illustrate the fact that this is 19 municipalities that that have 19 bureaucratic structures and multiple, sort of organizational structures. And this is not a region necessarily set up administratively to work together, but over time, the love of place keeps them bound together in a regional affinity. And that was work generations before that innovators in that region had tried to develop a sense of what the Fox Cities region, the Fox Valley part of Wisconsin could do together that they couldn't do alone as small towns and small counties. And what they've done recently is to come to grips with the idea that the fragmented present that folks are working through has a lot of signs of things that people do not want to continue, right? A pattern systemically where some people will say they're thriving, many others are struggling and suffering. This was one of the world's epicenter of the paper industry in the latter half of the 20th century. That industry has declined, a new economy is taking shape, and there are questions about what is going to be the economic, the character of the economy in this region. With that is growing diversity, but also youth moving away, open questions about what the next generation of civic leaders will do when prior generations are aging and their legacies are literally in doubt. And so that open worry about what's going on for the next generation had led to pretty far-reaching discussions about a visionary future, one that hits a lot of the marks that bring forward a human characteristic to this, really thinking about what it means to get strong starts for kids, positive life paths, thinking about, not just one service or program area, but really what is that life course developmental pathway that gets kids growing through those transition states of early life and adolescence into adulthood, and really thinking about the shared spaces that are created, cultural environments, physical environments, and above all, a belief that all belong and that all can experience that. Those are lovely animating visions, and lots of people spoke eloquently about them, but they become a little bit hard to work into, just as that green curve is, it rises slowly. It takes a long time to become the norm. What the colleagues in Fox Cities have managed to do is to build ways of working right now in the present, that give people the experience of some of that interdependent work together, right? To actually come together in scores of community dialogues, to actually do waves of well-being surveys, asking neighbors, do you feel like you belong? Are you thriving or struggling and suffering? And the questions in very short surveys can be illuminating, and they've done multiple rounds of that. They've articulated, a living vision that anchors this work into intergenerational aspirations. But then there's a belonging team that is really taking to heart the idea that many people who have made, come here, let's say for college, and might otherwise leave, are leaving because they don't necessarily feel this is a place for them. How can this work change when belonging is the goal for it? I won't read each of these, but impressive work around shared stewardship that actually increases the odds that interdependent future will come true. So that's our next little mini dialogue here is as change makers in this work, where do you look for signals, or what are you seeing as signals of that kind of maybe promising future that is on the margins now, but that give you hope? And where do you look for those? Because by definition, that's not what mainstream media, it's not what mainstream publications or storytelling necessarily feeds us. So if we're going to be stewards of an H3 future, we're going to have to learn how to notice those innovations around the edges, and we're going to end up having to deliberately look for stories of serious stewards in action. So we wanted to spend a few minutes right now just hearing your thoughts about what signals you're seeing and where are you looking for these kinds of stories in your own work.
I see Ellen's hand
Oh, yeah,
raised.
go ahead, Ellen. Great, perfect, thank you.
Sure. So I actually think a lot about signals of change, and I typically think more broadly about culture change, but one of the things that has come up for me a lot recently is just hearing from all different areas of our society, certainly not just limited to healthcare or civic engagement, but hearing a real interest in other ways of knowing. So sort of broadening out, especially thinking about lived experience, thinking about knowledge that really resides in places, and people in communities who are anchored in those places, whether it's indigenous or communities like Fox Cities that are, they're really focused on their place and developing their own knowledge and their own vision of that place. And I feel like I keep hearing this coming up all different places, from climate research in the Arctic to healthcare redesign and everything in between, that there's sort of a recognition that we actually have to reimagine what is evidence, what is knowledge, how do we go about understanding the world about us? Not a rejection of science, but sort of a broadening out to recognizing there are some things we've been missing. And that gives me a lot of hope. It feels like a pretty fundamental shift, actually, that I feel okay, we're actually rethinking some things that are really, really foundational, that it's probably opening a lot of doorways. And that gives me hope that, there are some new visions that will come from understanding the world around us in new ways.
Lovely. Couldn't have said it better. Is it Bet?
Hi, everyone. I do look for signals, and I always do. I'm very sensitive to them, in fact. So anything that I feel negative, I really stay away as fast as I can. It's almost like you're walking across the street, you see a truck coming, you're backing up. So things that we learn when we were young, that things that just negative, any negative energy I turn off. Positive, yes, and I move along with you. Thank you for asking.
Yeah, it's a lovely question. We'll come to you in 1 second, Paul, but I just want to just reinforce this idea that we don't want to be blind or indifferent to the negativity in the world, but we don't want to fuel it, right? We don't want to repeat it. And the idea, the choice, Maggie emphasized this at the top, right? It's a choice to repeat the patterns that we are immersed in, or to like deliberately try to sort of instill a different way of working. And I hear that in your comment here, right? We can see the negativity, but we can choose whether to participate and perpetuate it or not. And I just thank you so much for that. Paul, did you have your hand up?
Yeah, so I guess what I'd share is that I look at this through a healthcare lens. And in preparing for this class, I realized that the term population health only really emerged in 2003 in a white paper at the University of Wisconsin entitled, "What is Population Health?" The term social determinants of health, I think, didn't really enter the broader lexicon of the healthcare system until 2017 or 18, even though public health people understood it for decades. And the term health equity really only emerged post-COVID, the murder of George Floyd, the social justice movement. So we're making progress in that. At least we're beginning to label it, identify it, study it. And when I first started to develop this course, I thought, is health equity just a term that large incumbent firms are using to say that they're doing the right thing while they're still, making money in a fee-for-service system? But I'm more and more encouraged. Webinars like this, just conferences, just thought leaders that are getting together. It feels like there's just a conversation going on out there that isn't going to go away. And while I fear progress will be on a glacial pace, I think it's progress. So those are some of the signals that I've seen.
Yeah, it's a great example of a trend that might feel really hot to a subgroup, can take a while to transfer into the mainstream. And then once it becomes mainstream, you're sitting in a school that is basically educating and socializing the next generation. That takes even more time to work it into a new curriculum. And what is the world that we're preparing the next generation of professionals into? So it's a perfect example where we can work over multiple timescales and see the innovations that are worth paying attention to, and then make choices about how much, Maggie used the word nurture, right? A big part of cultivating the move from H2 to H3 is really a deliberate choice of what to nurture. And that is, being thoughtful about what we dislike about the present that we could replace with something better. David.
Well, and this is really cool. Thank you for doing this. One of the things that I think about when I look at the graphs is how many people are profiting from the current system, and how that the height there could be popularity. That first top of the screen could be popularity. But then we come along, we say, no, there's this other vision here. And we're talking about something that doesn't exist. And so who's for it? Well, not a lot of people are for it because they don't understand it, because they haven't been through the Fox cities, kind of sit around and imagine each other. So there's a real challenge to creating a story and the political support in a community for that story of how to improve things. So the signals I look for are people who, notwithstanding those two negatives, are breaking through. Because that's not the systemic solution. The systemic solution is when the ordinary kind of becomes that delivery. But for now, it's that place where there's a unique combination of a local foundation or a local leader or leaders that are showing the path forward, whether it's Nuka up in Alaska or Cherokee and other places, or Fox cities. These people who have broken through the wall, notwithstanding the fact that it's a hell of a big wall with a lot of money behind it.
Yeah, the phrase that has become pretty popular lately, and when thinking about what is it, where should we look for these signs, and what will we imagine seeing? It's not a wave of everybody doing a new thing all at once. It's not like that kind of like instantaneous recognition at a large scale. It's usually small pockets of coherence as people start thinking of a new way of working. It starts to take hold, and then it begins to spread as the bridges between those pockets, those islands of coherence, start to connect with each other. And then we start getting signals that this work is that there is sort of a new standard, a different way of working that is increasingly being rewarded, and that the sort of the risks start changing when you're not the first mover necessarily, but you may be the first mover in your organization or in your community. This is always difficult to have very little time, but we wanted to end with a few thoughts of like actions that if you want to start being a Three Horizon practitioner, bring this into the kind of stewardship that you practice. As a team, we kind of dreamed up these 5 starting places. One, you cannot overemphasize the importance of the imagination, right? We have to be able, and it is daring to be the one that's talking about something much better, something significantly worth our time and our energy, our heart. Those aspirations really anchor and animate this work. And so we have to be able to talk about things that don't exist and create spaces where we can dream. A lot of this turns into what is talked about as an imagination infrastructure, right? One of the features of H1 systems is that they don't give us much room to dream, much less to breathe sometimes. And that constant crisis, the tyranny of the urgent, is causing us to erode our goals and not even to really take our aspirations seriously. And so daring to imagine is a pretty major move here to create space and legitimacy for something much better. We can bridge timescales. We can reject the logic that you can only get to the future by going through the medium and can't get to the future without going through the short and the long medium first. That is really not so much true, right? We see examples of H1, H2, H3 all in play today. And the question is, how do we imagine working across these different scales through the present work that we're doing now? We can look for the kind of scanning function. The people who've shared today, sounds like you're doing that already, right? Bet's got a way of recognizing the negativity and concentrating on those signs that she wants to be a part of. How do we develop the courage to do this work, to let go of those harmful practices? We're working in very dehumanizing times, and to stand up and be human, as Maggie said, is tough. And that means standing for the cause of healing and for liberation. And lastly, now that we share a little shorthand, we can describe our Three Horizons stories to each other. What counts as H1 for you, right? What is your H2 minus move versus H2 plus? Organizations that start committing to this end up being able to more effectively discern how they see the world and what they most want to accomplish. So let me stop there and let Brooke wrap it up.
Okay, thank you all for joining us today. We heard a lot about the Three Horizons framework, why it matters, and we got to see some examples of what it looks like in practice. So as with all the webinars, we hope that the information and insights shared are helpful to you and your work. On this slide are additional resources that you can access to learn more. Like we said before, we will send you all of the information with these links. Before we move on to the Q&A portion, we just want to take a few minutes. We want you to fill out a brief survey on today's webinar. Your feedback is very valuable to us and will help improve our future offerings. So that link is in the chat. So if you could fill that out, we would really appreciate it. And as we just want to say, like, as our efforts to navigate, different futures across the country, we really want people to think beyond the now and really take hold on how to drive transformation. So Ripple's committed to sharing stories of stewardship in action and learning from others. So we invite you to share some stories from your organizations. And we can help get those out through different outlets. And we're dedicated through sharing those stewardship stories through our Unsung Stewards podcast and our Stewards Rising campaign. Both of those celebrate diverse efforts of stewards. So if you have any stories that you want to share, please reach out directly to Layla Hussein. She is Ripple's Deputy Director of Communications. And her information will also be shared. Thank you, Layla, for sharing your email. And as mentioned earlier, our next webinar on resident engagement will take place in April. So please be on the lookout for more information and a registration link. And we hope you'll join us for the resident engagement webinar. Lastly, I want to share for those of you guys that registered, we will be sending out the recording and the slides to the email address you used to register. So that concludes the presentation portion of today's webinar. Please feel free to unmute yourselves and share any observations, reflections, or questions. Thank you.